authorities of the Lagos State University Teaching Hospital say it has handed over to the police an impostor who specializes in selling COVID-19 vaccination cards without jabs. The suspect, Solomon Oriere, said to be selling fake but authentic COVID-19 test results, was arrested following an investigative report published by Nigeria's online media. A statement from the teaching hospital says the suspect has made confessional statements confirming that he isn't a member of staff of the institution. And according to the statement, the suspected fraudster must have gained illegal access to the National Primary Healthcare Development Agency website and secretly been working with other officials who aren't within the teaching hospital. The medical tertiary institution promised to keep the public abreast of the findings of its investigation. Now, months after the Scale 3.0 COVID-19 vaccination program ended, health workers in Ondo State are yet to get their allowances. Correspondent Sarah Ayeku tells the story of how these frontline workers manage meager earnings and limited hospital supplies. They have more in this report.
Me breaking share iṣẹ́ ó ti ń dùn mí kéèyàn carry for 17 years over 20,000.
Rosalind Yewande Ajadi is a community health assistant at the Primary Health Center in Agbaluku, Arigidi Akoko, one of the suburbs of Akoko Northwest Local Government Area of Ondo State, Southwest Nigeria. For 10 years, Ms. Yewande did almost everything that would make her qualify as a health personnel, spending millions to get her certificate. Since 2018, when she started working under the NPower program, her monthly earnings are yet to reach the 30,000 naira minimum wage mark. In spite of that, she and her team constantly go into the 12 communities attached to the facility with the COVID vaccination message. But it is difficult sometimes.
COVID-19 I joined outreach kiri ni, so àwọn èèyàn turn up fún COVID-19 vaccine nígbà yẹn dáadáa. Nǹkan tó kàn ṣẹlẹ̀ tó tún fa ìfàsẹ́yìn bá àwọn èèyàn ni pé tó yẹ kí wọ́n wá àwọn míì báyìí ti dì fún second dose kò sí vaccine tó yẹ kí wọ́n gbà bíi Pfizer kò sí ńlẹ̀. So second dose yóò jẹ́ káwọn èèyàn fàsẹ́yìn èèyàn tó ti rìn bí ẹ̀márùn ẹ̀mẹ́fà tó rí vaccine gbà so kò sí nǹkan tó fẹ́ gbà.
Most Nigerians may have forgotten the dreadful moments COVID brought and the 3,155 deaths recorded during the pandemic, with states like Ondo still lagging behind on the vaccination table. The health system is threatened, particularly for children under 5 and pregnant women.
By one okere, I need to extend the day fún wa. Ẹlẹ́kejì kò sí staff rárá tó jẹ́ kó tẹ́ máa attend sí àwọn èèyàn. Ẹlẹ́kẹta tẹ́tẹ́lẹ̀ wọn máa ń kó oògùn wá báyìí kò sí kan free mọ́. So àwọn èèyàn wọ́n nídìí pé tán bá wá at least àwọ̀ díẹ̀díẹ̀ tán bá ìjọba bá kó oògùn fún wa wọ́n lè máa rí oògùn fún àwọn èèyàn.
Tí bá sọ pé kò sí oògùn, àwọn oògùn wọn máa ń supply internet.
Bí anti-malaria àwọn ọmọ kéékèèké báyìí under 5 tẹ́tẹ́lẹ̀ owó wọn is free but now kò sí bẹ́ẹ̀ yẹn mọ́. Nǹkan tó bá ti aláboyún gan tẹ́tẹ́lẹ̀ ọ̀fẹ́ ni wọ́n dẹ̀ máa ń kó nǹkan fún wọn tó yẹ pé wọ́n máa lò but báyìí tán bá dé owó tán bá ṣe oná lèèyàn fún ọlọ́run fún oògùn á fi kó wá bíbá ìpadà.
Every day she resumes work, hoping that things will get better, but her hope is thinning out. No word of a possible salary increase. The thought of working here under relatively harsh conditions with paltry sum and staggered allowances tears her up.
Ó ti ń dùn mí kéèyàn carry for 17 years over 20,000 ṣé mọ̀ so ẹlẹ́dàá mi kò ṣiṣẹ́ mọ́ January bí. So it's okay. So 17 years, èmi nìkan the only daughter dad mi. Ó dẹ̀ ti dàgbà. So déyàn bá kàwé, ó yẹ kéèyàn ṣiṣẹ́.
At another facility, 10 minutes away from the center, on Maternity Street, an uneven road leads you to another primary health center in Imo, Arigidi Akoko. Here, the signpost reads, 24 hours service. But the situation at the facility presents its own challenges. Shortage of staff, insecurity, and fear of the unknown stop the health workers from running the night shift.
90 days, no, so I fẹ́ fi ṣiṣẹ́ yẹn. But now, àrówó gbà àwọn yẹn dẹ̀ ní emid and vaccinator wa so wọn due to pé wọn rówó gbà wọn encourage láti wá mọ́ bá tilẹ̀ pè wọ́n wọn dá wa lóhùn so àwọn ló dẹ̀ mójú ìlú tí wọ́n mọ̀ bọ́n ṣe lè bá wa fi ọgbọ́n kó àwọn ènìyàn jọ láti lè gba vaccine yẹn bó ṣe tọ́ àti bó ṣe yẹ so due to pé wọn ò rówó àwọn náà wọn wá fẹ́ fi taratara ṣiṣẹ́ yẹn mọ́ ẹ jọ̀ọ́ kẹ́ bá wa rọ ìjọba kán fún wa lówó iṣẹ́ tá a ṣe so that kíṣẹ́ yẹn lè máa lọ bó tún ṣe yẹ kó lọ even though ọ̀pọ̀lọpọ̀ káàdì wà nílẹ̀ tó yẹ ká synchronize ẹ̀ due to pé kò sí data àti owó fáwọn tó yẹ kó ṣiṣẹ́ yẹn so káàdì yẹn kò wà nílẹ̀ ni wọn ò ṣe àwọn èèyàn dẹ̀ ń wá láti wá gba káàdì yẹn due to pé wọn ò rí ṣe àmọ́ bá ṣe lè fún wọn ní káàdì yẹn láì synchronize ẹ̀.
Up till now, there is nothing, no penny was given to all these health workers, and they have worked tirelessly. Some have exhausted their resources, their energy on this vaccination. Some even use their salary to go from one community to another. There are some settlements that they will spend 40,000 naira a day, per day, to the LGA, even from one settlement to another. There are some that will spend 16,000 naira per day, come back to their health facility. But up till now, they have not done anything. And to worsen the situation, they integrate COVID-19 into measles campaign. The measles teams were given stipends for their transport logistics, while the COVID team were not given penny, and they have not paid them for the past 90 days.
As frontline survivors during the COVID-19 pandemic, these health workers are still fighting worse viruses and trying to survive with little money in their pockets. Sarah Ayeku, TVC News, Akure.
Well, in other news now, 12 inmates at the correctional center in Yenagoa, Bayelsa State Capital, have regained freedom as the state chief judge, Justice Kate Abiri, seeks to decongest the facility overburdened with prisoners. We have more in this report.
In what might be her last official visit to the Medium Security Custodian Center, Okaka, the Chief Judge of Bayelsa State, Justice Kate Abiri, ordered the immediate release of 12 prisoners from the facility in an attempt to decongest the place already overburdened with prisoners. The inmates arrested for petty crimes such as stealing, burglary, and breach of public peace were predominant among the freed prisoners.
Thank you, ma'am. God will bless you and your family.
Justice Abiri, however, called for more assistance from the federal government in expanding correctional facilities across the country, as well as the provision of more vehicles for the transportation of prisoners.
In as much as the government is doing something, I think you should also put some pressure on the federal government to do their own too. Except they want to now give states the power to run prisons. The facility has not been expanded, and I think there's enough land that can put, even if it is a story building or something, more hostels for the inmates.
Let me quickly thank you for providing us court cells and office space in the High Court complex, and therefore preventing escape in the court. We pray similar gesture should be extended to Magistrate Court complex. With inmate population of 650, we convey on daily basis more than 50 inmates to the court, and the old mini Black Maria are grossly inadequate for this onerous tax.
Relatives of inmates were also urged to meet bail conditions on time for their loved ones to regain freedom.
There's a need for decongestion of the custodial center. My call to them is that they should try as much as possible to meet the bail conditions so that they can release these inmates and let them go and reunite with their families.
Despite the gesture from the Chief Judge, the need for the decongestion of the Okaka Correctional Center, which houses over 600 prisoners, must not be overemphasized.